Now let's discuss the most common reasons why you might have an EMG test. The first thing we should know, right, is that there's 4 entrapment neuropathies on the body, right? First of all, it's carpal tunnel syndrome at the wrist. This is when you have pain at the wrist, when you have tingling and numbness radiating into the first 4 fingers, right? Predominantly maybe the first 2 or the first 3. So burning sensation is not normal to feel that way. Okay, that means that maybe the nerve at the level of the wrist here is compromised. Now, the first thing you need to know is that the nerve at the level of the wrist, right, is extremely superficial. I could make an incision, pull out the nerve. So then it can easily get affected, especially with disease, old age, or traumatic injuries, or accidents. And that's one of the reasons you might have an EMG test. They'll study the electrical activity of the muscle. They also study the speed of the nerve at the level of the wrist, and they can tell if the nerve is compromised or is affected or not. And then after that, you might have some physical therapy or some treatment plan. Another reason to have an EMG is when you have the ulnar nerve here, right at the level of the elbow. The ulnar nerve is extremely superficial. Again, I could make an incision and pull out the nerve, so it can get injured fast. We can study the speed of the nerve at the level of the elbow, below and above, and we can tell if the nerve is affected or not. So that's another reason to have an EMG. Also, other reason to have an EMG is when the nerve gets compromised at the level of the knee. The same way at the elbow, we can study the speed of the nerve when it comes to below and above the knee, and we can tell if the nerve is compromised or not. Also, you have tarsal tunnel syndrome, which is the carpal tunnel of the ankle. The nerve gets compromised because the nerve is extremely superficial, and it can get affected with disease, injuries, accidents, old age. Those are what you call entrapment neuropathies. That's the specialty of the nerve conduction study technologists. Now, another reason why you might have an EMG is called a cervical radiculopathy. Means that you have a pinched nerve at the level of the neck. Okay, in the neck you have different levels, like the main levels are from C3 to C8, and any of those levels can get compromised. It can get affected. For instance, when it comes to having an MRI, it can probably show that the disc, you have a bulging disc or a herniated disc, or you might have some spasms, and then after that it could get a little bit more serious, but we're discussing the most basic ones. So if you have some spasms, or probably the disc is herniated, or you have a bulging disc, then he can go with the needle electrode, study the electrical activity of that muscle, and he could pick up that nerve irritation, that nerve inflammation, or if the nerve is pinched or not. Same thing with the lower back, right? You can have an MRI. You can know if the MRI will show if you have a bulging disc or a herniated disc, and then the clinician will study the electrical activity of the muscles of the spine, and then he can tell if the nerves is compromised or not. And also you have the mid-back, which is the thoracic spine, right? You got thoracic is huge. From 1, you have 12 divisions, from T1 to all the way to T12, and then he can maybe sample or study a couple of levels. But if he has an MRI, then he can know exactly what's going on. So you have cervical radiculopathy, which is the neck. You have thoracic radiculopathy right in the middle back, and then you also have lumbar radiculopathy, which is in the lower back. Those are the main reasons why you can have an EMG test. Other reasons, right, very important too, that I didn't mention, I should have mentioned that in the first part. You can also have peripheral neuropathies. Peripheral neuropathies in the upper extremities, right? It means that multiple nerves are affected. Usually happens sometimes when the patient has maybe rheumatoid arthritis or diabetes, older age, and other diseases. So many other diseases, we don't have time to discuss all of them, but sometimes disease could take a toll, and it can really affect your peripheral nerves. Then you also have polyneuropathies. Polyneuropathy is when the nerves are affected both in the upper and lower extremities. And I forgot to mention peripheral neuropathy only on the lower extremities as well. That's when multiple nerves are compromised or affected. So there you have it. So I want you to remember that. Reasons for EMG testing: you have carpal tunnel at the wrist, ulnar neuropathy at the elbow, peroneal nerve neuropathy or entrapment at the knee, tarsal tunnel at the ankle, you have cervical radiculopathy at the neck, you have thoracic radiculopathy in the mid-back, you have lumbar radiculopathy in the lower back, peripheral neuropathies when multiple nerves are affected, either on the upper or lower extremities. You also have polyneuropathies when nerves are affected both in the upper and lower extremity. You can have sciatica, which is sciatic neuropathy. That's when the S1 root gets compromised, right at the lower part of the lower back. Okay, so with that being said, those are the most basic. I mean, you have other reasons, you have many other reasons, but they're uncommon. What I just mentioned are the most common ones that you're going to need an EMG test. With that being said, if you have any questions regarding the electrodiagnostic testing, my name is Louis from ndxtesting.com. I'll see you in the next video. Bye-bye.